If you're looking for ways to prevent vaginal atrophy before it sets in during menopause, then I have great information for you. Make sure to listen to this complete video. While it's not always possible to completely prevent vaginal atrophy, there are a few things you can do to potentially reduce the risk or delay its onset. So, let me share some tips with you. The first one, stay sexually active. Regular sexual activity, including vaginal penetration, can help maintain blood flow and promote natural lubrication in the vagina. This can help preserve the elasticity and health of the vaginal tissues. So, if you're not sexually active, using a water based lubricant during self stimulation can also be beneficial and can get you back into shape if you have stopped having sexual activity. So, the use of vaginal moisturizers as soon as the signs of perimenopause begin to show is a good idea. If you're wondering why that might be, well, it's because of hydration. So, just like the skin on the rest of your body needs moisturizers to stay soft and supple, well, our vaginal tissues need some love too. As we age and approach menopause, our hormonal levels change, which can lead to vaginal dryness, which is a condition called vaginal atrophy. By using vaginal moisturizers regularly, you can help keep those tissues hydrated and prevent atrophy from taking hold. Think of it as giving your lady parts a drink of water to help keep them happy and healthy. So, why wait for menopause to hit? Start moisturizing now to keep your vaginal tissues well hydrated and feeling their best. Trust me, your future self will thank you. And I can personally attest to this because I let vaginal atrophy completely take hold. And by the time I decided to get back into sexual activity, it was very uncomfortable. So, what I did is actually developed my own line of vaginal moisturizers. I first developed them for myself. And then, once I realized how much of a great benefit they were giving to me, I worked with a manufacturer to bring them to market. And now they are available to you by Wet Orchid. That's the name. Go to wetorchid.com and you can check them out. But let's get back into the rest of this before I talk about those. I'll finish up the video with a little bit more information about those moisturizers. So, the next thing you need to do is engage in pelvic floor exercises. Pelvic floor exercises, also known as Kegels, help maintain the muscles around the vagina and can help with blood circulation in the area. And I said exercisers partly because there are actual devices that can be used, and sometimes they're called that, and I just sometimes mix up my words. But yes, there are devices that can help with the Kegel exercises, or you can do them without. You can look into both. But the exercises, essentially, they involve contracting and relaxing the pelvic floor muscles as if you're stopping the flow of urine. Yeah, you want to aim to do these exercises daily. Of course, though, talk to your healthcare provider before you start doing anything. Make sure that you're in health, healthy enough to do that. And then also, too, if you decide that you want to add any of those Kegel exercisers or devices, see if your doctor has any hangups about your reservations about you using those. And if they don't, you can also get vaginal dilators from our website, Wet Orchid. So just go on there and check out, just search for vaginal dilators and you'll find them. Anyway, so let's get into the next thing, which is maintain a healthy lifestyle. You want to eat a balanced diet, stay hydrated. That water is so important for all areas of your skin, and exercise regularly, not just the pelvic exercises, but your whole body, which can have a positive effect on your overall health, which will lead to vaginal health. So it's all connected. A healthy lifestyle will support hormonal balance the best it can while you're going through these changes and proper blood flow to the vaginal tissues, because part of it is circulation, keeping that blood flow down there. While we don't have as much estrogen to push that blood down there, you're going to have to do it in other ways, which exercise and eating healthy. So the next thing is for some women to try using estrogen therapy. So, depending on your medical history and symptoms, your healthcare provider may recommend estrogen therapy to prevent or manage vaginal atrophy. This may include topical estrogen creams, rings, or tablets specifically designed for vaginal use. It's important to consult with your healthcare provider about the potential benefits and risks associated with estrogen therapy. Now, there's some people who are like me who are previous cancer patients, or perhaps you have the genetic markers. Maybe somebody in your history of your family has had cancer. And once you consult with your doctor, they say, nope, you can't do estrogen because that's going to, bring back your cancer. Well, if that's the case, then you are going to be reliant on the things that I've already talked about, which are the vaginal moisturizers, the exercise, the healthy lifestyle, and such like that. So just keep that in mind, that it may be that you may not be able to take HRT, and start making plans accordingly to do what you need to do. And one thing just to mention real quick is, besides working with your doctor, is to work with a menopause coach. I also provide menopause coaching because, of course, I've been through all of this, and I can help you coordinate with your different doctors to come up with a regimen that's going to help you both with your diet, with doing the right exercises, as well as moisturizing down there, and if need be, using the vaginal dilators in a regular schedule. I can hold you accountable, keep you on that schedule, and help you, help yourself. So let's get into the next thing, which is avoid irritants. Certain products like douches, scented soaps, harsh detergents, they can all disrupt the natural pH balance of your vagina and cause dryness or irritation. Another thing to throw in that is a lot of personal lubricants, especially those ones that are super clear. Those are often made with a lot of glycerin, and glycerin has been shown to disrupt the vaginal tissues. It's made from a sugar-based vegetable substance, and I'm just saying this off the top of my head, so that doesn't sound very scientific, but it can promote yeast infections. Some of those lubricants have parabens, and those parabens have been shown, that's a preservative. Parabens have been shown to disrupt hormonal tissue. So it's just best to really watch out for lubricants. And let me throw in there that Wet Orchid has a natural lubricant named Nectar. It looks very much like your natural nectar that you have. It's water-based. It's made with a plant cellulose. It has hyaluronic acid to add moisture, and it has one simple preservative it's common food preservative that has never been shown to show any kind of disruptions with the vaginal tissue. So trot over to Wet Orchid and check that out. But besides those things, just try to avoid using products in and around the vagina that can have any kind of chemicals or harsh preservatives, sulfates. A lot of the soaps out there have sulfates. We have a sulfate-free wash. It's called the Gentle Petal Wash. Many of these products you buy, especially Walmart, Target, places like that, they have a lot of sulfates because most households have hard water. And so these soaps want you to have the idea that you're getting clean by giving that psychological effect of the sudsing. And so they add lots of sulfates to make sure it's going to suds up really well. And unfortunately, that dries your skin out. So, you don't really need sudsing. If anybody, like some women out there might use conditioner to wash their hair. Of you who do that, you know that it's not the sudsing that cleans it. It's the putting the product on that pulls the dirt away from your scalp. Well, it's the same thing with vaginal cleansers. You don't need something that suds up. You need something that is, formulated for your skin down there, and that, draws away the dirt without drawing away the oils and the natural, moisture in your vagina. So check out that petal protection balm on wetorchid.com. Also, if you need to replace the soaps that you're using. So just always opt for a mild, unscented, specifically formulated for your vaginal skin. So remember, it's always a good idea to consult with your healthcare provider before you make any significant changes. Go to them and show them the website, show them the products, and see what they recommend. Because, like I said, my first thing is making sure that you go to your doctor first, and then from there, I can help you through the website, through our products, and through the coaching. So, and of course, if you have questions about anything that we've talked about in this video, feel free to make a comment below and I will do my best to answer. If you haven't subscribed to the channel, please subscribe. Click the notification bell so you are made aware the next time we upload a video. Please share this video with anybody who might benefit from the information in it. And again, I am Christy. I am your host here. I'm happy to bring you this information and I hope to see you in the next video. Bye-bye.